Let's talk about the first trimester of pregnancy, the fragile, emotional, confusing phase where you're excited, scared, tired, nauseous, and Googling everything at 2 a.m. What does this mean? The first trimester is the foundation of pregnancy. It's short, but it carries so much weight physically, emotionally, and even spiritually. And honestly, a lot of women enter it unprepared, not because they don't care, but because nobody really breaks it down properly. In this video, I want us to talk woman to woman, no panic, no unnecessary fear, just understanding your body and knowing how to care for yourself and your baby in these early weeks.
I think I found it now. What I've been looking for. Isn't it beautiful? It's got my head all up in the clouds.
Before we go any further, to my returning subscribers, now go day. Thank you so much for always coming back, for trusting me, and for being part of this community. I truly don't take it lightly. Thank you so much. And if you are new here, welcome. You're very much in the right place. My name is Esther. I'm a nurse, a mom, and on this channel, we'll talk about our general health. We talk about women's health, motherhood, and real life health conversation explained in simple, relatable way. If that sounds like your kind of space, please consider subscribing, like this video, and share it with another woman who might need it, especially someone that is newly pregnant. Now, let's get straight into today's topic. This video is all about first trimester care, what it really means, what your body is doing behind the scenes, and how to take care of yourself without losing your mind. The first trimester usually covers week 1 to week 12, and even though you may not look pregnant yet, so much is already happening inside your body. Organs are forming, hormones are rising, and your body is working overtime. That's why symptoms feel intense during this stage. And that's also why care during this period is very important, because this is the stage where organs are forming. I want us to understand what is actually happening inside your body, because once you understand it, a lot of fears disappears. Many women think, why am I feeling this tired when I'm not even showing yet? Why am I nauseous all day? And it's just 1 month, and it's just 2 months. Why do I feel emotional for no reason? There's a reason, and your body is not malfunctioning. Your body is not overreacting. No, the first trimester is actually a very crucial stage. Like I said earlier, the first trimester runs roughly from week 1 to week 12 of pregnancy, and this is the stage where the foundation of your baby is being laid, literally. Even though the baby is tiny, this is the period where, like I said earlier, that the organs are forming, the brain starts forming, the heart begins to beat, the spinal cord develops, vital organs are being created. So yes, your body is doing heavy work silently. One of the biggest things happening right now is a massive rise in pregnancy hormones, especially HCG, progesterone, and estrogen. These hormones are responsible for keeping the pregnancy safe, but they also come with side effects. HCG is the hormone picked up by pregnancy tests. It's also the major reason for nausea and vomiting. Progesterone relaxes your muscles, including your digestive system. That's why you may feel bloated, constipated, or extremely tired. Estrogen affects mood, smell, and emotions. That's why small things can suddenly feel overwhelming. So, if you feel like sleeping all day, irritated easily, emotional for no clear reason, please hear this. It is not weakness. It is biology. Yes, it's biology. Why fatigue is so hard? It's biology. Many men say, I've never been this tired in my life. And it's true. Absolutely. Your body is increasing blood volume, supplying nutrients to the baby, adjusting metabolism, supporting placenta formation, all at once. That deep exhaustion is your body asking for rest, not you being lazy. A lot of women are surprised that symptoms feel worse in the first trimester than later. This is because hormones rise very fast early on, yes, and your body hasn't adapted yet. The placenta is not fully developed to take over hormone production, and as the pregnancy progresses, many symptoms is not because something is wrong now, but because your body adjusts later. Feeling unwell in the first trimester does not mean something bad will happen. Feeling okay also does not mean something is wrong. Every pregnancy expresses itself differently. Comparison will only steal your peace. Now, let's talk about the actual symptoms many women experience, and most importantly, how to tell what is normal and what needs medical attention. I want you to watch this with peace, not panic. Number one on my list is nausea and vomiting, which is also known as morning sickness. Despite the name morning sickness, it can happen any time of the day. What is normal? Nausea with or without vomiting? Absolutely normal. Symptoms worse in the morning or evening? Absolutely normal. Triggered by smells or certain foods? Normal. Eating slightly after eating small meals? Normal. This is largely due to the rising HCG level, which I said earlier. You need to seek help when you can't keep food or fluids down, or you are vomiting many times a day, or you are showing any signs of dehydration like very dark urine, dizziness, dry mouth. You need to seek medical attention. Severe vomiting is not something you should endure silently at home. Number two on my list is extreme tiredness. Feeling tired is one of the earliest and most common symptoms. You are needing more sleep, you are feeling drained even after resting, reduced energy for daily activities. All these are normal. This is your body prioritizing pregnancy. The only red flag here is that if there is extreme weakness with dizziness, fainting, or breathlessness, this may need blood test, especially for anemia. So you might need to seek medical attention if you are feeling that. Number three on my list is breast changes. Your breasts are preparing for breastfeeding from very early on, and it can feel tender, heavy, darkening of nipples, visible veins. They are all normal. If you're having severe pain with redness, fever, or discharge, this is not common in early pregnancy, but worth checking. Number four on my list is frequent urinations. You may feel like you're always going to the toilet. The major reason include increased blood flow to kidneys, hormonal changes, and pressure on the bladder. The only red flag here is that if there's burning or pain when urinating, if there's fever, cloudy or foul-smelling urine, this may suggest a urine infection and it needs treatment. So you need to go see your doctor about that. Number five on my list is mild cramping. This one causes a lot of anxiety. Mild pulling or stretching sensation, lower abdominal discomfort, or mild cramping that comes and goes. These are normal. This is usually due to the uterus growing or expanding. The red flag here is that if there's severe persistent pain, pain on one side only, or pain with bleeding, then you need to go see your doctor. You need to go see your doctor about that. Number six on my list is spotting or light bleeding. Light spotting can happen in early pregnancy. If you see a light brown or pink spotting, short-lived, and there's no severe pain, absolutely normal for some people. But you have to seek urgent care if bleeding is heavy like a period, if it is bright red blood with clots, or if you are bleeding with strong abdominal pain. For me, I would say that never ignore bleeding, even if it turns out to be harmless. Never ignore it. Just go and check it out and see what exactly is going on. Number seven on my list is mood changes and emotional sensitivity. Crying easily, feeling anxious or overwhelmed is very common. What is normal includes mood swings, irritability, heightened emotions, and the likes. Get support if sadness feels constant, or you feel hopeless or detached, or anxiety becomes overwhelming for you. Your mental health matters just as much. So kindly see your doctor if you feel like that. Having symptoms does not mean your pregnancy is in danger. Having few or no symptoms also does not mean something is wrong. Your body's response is unique. If this video is helping you, please like and subscribe. Now let's talk about care. The everyday things that truly support you and your baby in the first trimester. This is not about perfection. It's just about intentional care. Number one is rest is not optional. I'll say it again. Rest is not optional. This trimester demands rest. What to do? Sleep when your body asks for it. Take short naps if possible. Reduce unnecessary stress. And most importantly, listen to your body. Listen to your body. Rest is part of pregnancy care, not laziness. Things to avoid include pushing through exhaustion, feeling guilty for slowing down. Your body is doing invisible work, so you need to rest as much as possible. Number two on my list is nutrition. Simple, not complicated. You don't need a perfect diet. You don't need a balanced one, but I want you to focus on small frequent meals, complex carbohydrates like rice, yam, potatoes, whole grain, also protein, eggs, beans, fish, meat, tofu, fruits and vegetables when tolerated, and plenty of fluids. Please focus on these four. If nausea is bad, eat what stays down first, then we can improve variety later. What I want you to avoid or limit is skipping meals, very greasy or spicy foods if they worsen nausea for you, unpasteurized dairy avoid it. Undercooked meat or eggs, avoid it. And excess caffeine, avoid it. Number 3 on my list is folic acid and supplements. This is very, very important. Take folic acid 400 micrograms daily unless advised otherwise by your doctor, midwife, or GP, and also prenatal vitamins if prescribed. Folic acid helps prevent what we know as neural tube defect, especially important in early pregnancy. Avoid taking random supplements without advice or doubling doses because you missed a day. Like if you missed your dose yesterday, you don't need to double it up for the next day. Just take the dose for that day. Number 4 on my list is hydration matters more than you think. Dehydration can worsen nausea, headaches, constipation, and dizziness. So, I want you to sip water throughout the day. Try warm fluids if cold drinks worsen your nausea. Then you can also add lemon or ginger if that helps. You can put lemon or ginger inside water. Number 5 on my list is medications. You have to be very, very careful with medications at this stage. Not everything safe before pregnancy is safe now. I want you to always check with your doctor, your GP, midwife, pharmacist, nurse before taking medication. And also herbal remedies. You have to make sure that you speak to your doctor before taking them. Avoid self-medicating, painkillers, or antibiotics without advice, please. Number 6 is lifestyle choices. The safe habits that you can do at this stage is gentle walking, light stretching, taking fresh air, and please avoid completely smoking, alcohol, or any recreational drugs. There's no safe amount of alcohol in pregnancy, so please avoid them completely. Number 7 on my list is emotional and mental care. Pregnancy is not only physical. Talk to someone you trust. Give yourself grace and reduce pressure and comparison. If you feel overwhelmed, speak up early. Support is part of care in pregnancy. Number 8 on my list is antenatal booking and medical care. Book your first antenatal appointments. Inform your GP, your doctor, or midwife, and keep track of your symptoms. One thing I want us to know is that early care helps detect issues early. So if you register your antenatal early, is very good. Now, we'll be addressing questions many women have but feel shy or scared to ask. Yes, we'll talk about them. Let me say this clearly. Questions don't harm pregnancies. Misinformation does. So if you have any questions, feel free to ask. Number 1 on my list is sex in the first trimester. This is one of the most common fears. The truth is, sex is generally safe in the first trimester for most pregnancies. Your baby is well protected by the uterus, amniotic fluid, and strong muscles of the womb. Sex does not touch the baby. And to avoid or check with your healthcare provider is if there is vaginal bleeding, if there is severe abdominal pain, or if you have history of recurrent miscarriages, or if you have placental issues and this has already been diagnosed. If your healthcare provider hasn't restricted you, intimacy is usually safe. Number 2 on my list is exercise. Should you rest completely? You don't need bed rest unless advised. Let me mention some safe activities you can do. Walking, gentle stretching, natal yoga, light household activities. Yes, you can do all this. What you have to avoid is high impact workouts, heavy lifting, activities with risk of falls. Listen to your body. Pregnancy is not the time for extremes or to show that you can do some things. Number 3 is walking during the first trimester. Many women continue walking even when tired. Going to work if you feel you are able to, it's okay. Adjusting workload, taking breaks, good, but you have to be cautious if your jobs involve heavy lifting, prolonged standing, exposure to chemicals or infection. You have to speak to your employer early, and if adjustments are needed, your employer will be able to do that for you. Your health comes first. Number 4, lifting and household chores. You don't need to stop living, but be sensible. Light chores, lifting small items, completely okay. What you have to avoid is heavy lifting, straining your body, or overexertion. Ask for help. Pregnancy is not a competition. Always ask for help when needed. Number 5 on my list is travel in the first trimester. Travel is usually safe, but comfort matters. If traveling, stay hydrated, take breaks, avoid long uncomfortable journeys if nauseous. Always check travel plans with your provider if you have complications. Make sure you are always speaking with your healthcare provider about it. Now, let's talk about some common fears and myths. We'll quickly address some myths. They will say nausea means something is wrong. It is usually hormonal. This is false. It is usually hormonal. No symptoms means something is wrong. Every pregnancy is different. That is also false. Or bending causes miscarriage. It's also false. Miscarriages are usually due to chromosomal issues. Morning sickness does not mean your baby is unhealthy. Sex and gentle exercise do not cause miscarriage in normal pregnancies. Having no symptoms doesn't mean something is wrong. Cravings and aversions are normal. Don't feel guilty or alarmed about it. Ignore fear-mongering advice. Focus on evidence and your care team guidance. Let me mention when you are to seek help immediately. Number 1 is vaginal bleeding. Eye spotting or brand discharge, which are short-lived, can be normal. But heavy bleeding, bright red blood, clots, or bleeding with severe cramping, contact your GP or midwife immediately. Number 2, severe abdominal pain or cramping. Mind cramps are common, but intense persistent pain, especially on one side, possibly with bleeding. Possible cause can be ectopic pregnancy or miscarriage or ovarian issues. So you have to seek immediate medical attention. Number 3, persistent vomiting and dehydration. Morning sickness is normal, but vomiting so frequent, you can't keep fluids or food down, or you have seen signs of dehydration like dark urine, dizziness, or dry mouth, contact your GP. You may need medication or IV fluids. Number 4, high fever or infection signs. Mild colds, they might be normal, but if you have high fever, chills, burning urination, foul smelling discharge, then you have to seek medical care promptly. Infections can affect both you and your baby, so you need to seek help immediately as well. Number 5 is dizziness, fainting, or severe fatigue. First trimester fatigue is normal, but extreme weakness, fainting, heart palpitations, or shortness of breath gets evaluated. This could indicate anemia, low blood sugar, or other complications. Number 6 is unusual symptoms like sudden severe headache, vision changes, or swelling. These symptoms that feels off or usual for you. One thing I always say is that you should trust your instincts and call your midwife or GP if you notice any unusual symptoms. Number 7 is mental health red flags. Persistent sadness or hopelessness or anxiety. Thoughts of harming yourself or feeling detached from reality. Reach out immediately to a healthcare provider. You have to seek immediate medical attention. Early support is crucial. Now, let's focus on practical lifestyle hacks. Little things you can do every day to feel more comfortable, calm, and in control during the first trimester. These tips are easy, realistic, and meant to reduce stress. But one I'll be talking about is how to manage nausea and food sensitivities. Eat small, frequent meals instead of large ones. Then keep plain snacks nearby. Crackers, dry toast, or nuts. Drink fluids in small sips, especially ginger or lemon water. Avoid strong smelling or greasy foods that trigger nausea. Pro tip, keep something bland by your bedside. If you wake up feeling sick, a few bites can prevent morning nausea from taking over your day. Number 2, about how to boost energy and fight fatigue. Number 1 is prioritize sleep. Go to bed earlier if possible. Take short naps when you can. Then gentle movements like a short walk can improve circulation and mood. Avoid overcommitting. It's okay to say no. If you're unable to do something at a particular time, it's okay to say no. Number 3 that I'll be talking about is comfort clothing and physical ease. Use soft clothing, reduce bloating or discomfort. Avoid tight clothing this period. Wear supportive bras to reduce breast soreness. Avoid tight waistbands, especially around the abdomen. Comfortable shoes reduce fatigue if standing for long periods. Number 4, let's talk about hydration and digestion. Drink plenty of water throughout the day. Some drinks like herbal teas, soups, all this can also soothe nausea. Eat high fiber foods, fruits, vegetables, oats, beans, all this to help prevent constipation, and avoid long periods without food to keep blood sugar stable. Number 5, let's talk about how to manage our mood swings and emotional health during this period. Number 1, give yourself grace. Emotional highs and lows are completely normal. Journal your feelings or practice mindfulness or meditation. Then talk to supportive friend, partner, or your midwife or GP. Light activities like music, prayer, or gentle stretching can also calm stress. Number 6, small daily habits that will help you to be comfortable. Number 1, plan your day. Plan your day around your energy peaks. Sit down while doing chores if possible. Keep frequent light meals and snacks on hand, and avoid unnecessary stress and prioritize rest. Number 7 is use technology wisely. Pregnancy apps can track symptoms, appointments, and reminders. Then use reportable sources for information. Avoid panic-inducing forums. Record questions for your next midwife appointment. If you have any question, write it down so that you can ask. Write it down so you don't forget. First trimester is tough. There's no shame in taking it slow and caring for yourself. More consistent habits can make a huge difference. The first trimester is intense, exhausting, and sometimes overwhelming, and that is normal. Take care of your body, mind, and emotions. Listen to your instincts. I can't overemphasize this. Seek help when needed. Rest, eat, hydrate, and lean on your support system. You're doing something amazing. Even if it doesn't feel like it, you are enough, and your baby is lucky to have you. If this video helped you, please like, subscribe, and share with another mom-to-be who might need reassurance. And comment below with your questions or experiences. Love to hear from you. Thank you for watching, and remember, your first trimester is tough, but it's just the beginning of a beautiful journey.
I think I found it now. What I've been looking for. Isn't it beautiful? It's got my head all up